Ron Duckworth here to talk to you about the EMT's Guide to Acute Coronary Syndromes, which I'll be presenting at this year's EMS Today conference. We're talking about acute coronary syndromes, chest pain, STEMI, cardiac compromise, myocardial infarction, unstable angina, STEMI, NSTEMI, angina pectoris, cardiac compromise. All of these concepts can be difficult to sort out. What ones fall under what else? How do we differentiate between them? What tools do we need? What is the exact role of tests and diagnostic equipment like a 12-lead EKG? Certainly the more that we can do and the more diagnostics that we can apply to a patient's situation, hopefully the more information that we're going to be able to get, and it's going to make it easier for us to deliver care pre-hospitally as well as to coordinate and deliver this patient to the right care in the hospital. That's all certainly facts that have not changed. But we're going to take a look at not only the pathophysiology of what we're right now calling STEMI, unstable angina, NSTEMI. We're going to take a look at what that means to EMTs in the street, what that means to coordination with paramedics, with hospital personnel, as well as where we might be going with some of these concepts in acute coronary syndromes, such as what we're right now calling OMI or OMI, occlusive myocardial infarction. Sort of giving us a better perspective on the really key role of assessment, history taking, really rock solid history taking to help move these patients to where they need to be and to direct our care. We're going to be busting acute coronary syndromes myths, and most importantly, we're going to be answering your questions because we're all getting in the same room. That's what it's really all about. We're going to help you better coordinate your health care with partners all along the continuum of care. So I hope to see you at the EMT's Guide to Acute Coronary Syndromes at EMS Today 2019.